very excited to be sharing the presentation today with Megan. So let's get started. This was a really fun presentation for me to put together because it is important for everyone in the profession to understand what advocacy and government affairs does for you. And so everything that we're doing is to shape the future of your career. We want to recruit and retain respiratory therapists and make sure that we protect your license. So advocacy affects your future job opportunities, your ability to work across state lines, patient access to respiratory care, workforce shortages and staffing, Medicare reimbursement and recognition, and professional growth and leadership opportunities. So our learning objectives today, you should be able to describe the purpose of AARC Advocacy and identify ways it supports respiratory therapists and patients, summarize the current status of the Respiratory Care Interstate Compact. We refer to that as the RCIC, and understand the anticipated implementation milestones, and identify opportunities for you as students and recent grads to engage in advocacy and professional leadership. So AARC's advocacy covers federal, state, and regulatory affairs, and we focus on protecting your license. We're currently working on the last state that's working on licensure, and that's the state of Alaska. Expanding patient access, because what's good for patients is good for respiratory therapists is good for patients. Every time that you have another opportunity to practice in a setting, that's better for patients who have respiratory diseases. We support workforce initiatives, advance the profession, and we do a lot of educating of lawmakers and regulators, including those who have oversight over Medicare at the Centers for Medicare and Medicaid Services. Our vision at the AARC is that we will be the leading organization to advance the profession of respiratory care worldwide. So our advocacy also protects the profession. It defends licensure and your scope of practice. We support patient safety and improve access in rural communities. We promote recognition of RT expertise, and again, expand career opportunities, support work mobility through the RCIC, Compact Licensure, and I'm going to tell you much more about that. We are working to advance workforce development. We support Medicare oxygen payment reform and expand pulmonary rehab access. So we do a lot of our work virtually, although we have face-to-face meetings. We have action alerts on an advocacy platform known as Muster, and you can look at the QR code, and that will take you to some of our work on the website. So we have toolkits there for each state supporting engagement with representatives, and we have optimized that website and continue coverage through AARC podcasts, news, and media. So you will find a button that says advocacy on the homepage of the AARC's website, and you can get engaged in advocacy there. So what is compact licensure? The most important thing to know is that licensure, as you know, is a state jurisdictional issue, and compact does not eliminate state licensure or lower the standards for patient safety. Licensure through a compact is essentially a contract that the states engage in together, that they will allow practitioners outside of the state to come in and practice in their state. So it means that any states that are participating will be part of the compact. If the states are not participating, they're not part of the compact. So you will have an option when the compact is fully implemented to be able to get a home state license and also a compact license if your state is participating. So we think that this is really great. One of the things I want to call out is that it's reducing barriers for military spouses, and that's why the Department of Defense engaged with us and gave us a contract. So the Council of State Governments has a national center for interstate compacts, and they serve as a resource for our states. And they have been taking a look at all of the legislation. We came up with draft legislation so that each of the states could use have the same contract, if you will. And so the model legislation was created by AARC, the Department of Defense, and the Council of State Governments. We have a legislative review of that legislation. For instance, right now we have a state where the sponsor of that legislation wants to add an amendment that would make it the legislation not compatible. So the state, if they added that amendment to the legislation, won't be able to be part of the compact. We identify sponsors in the various state legislatures. We have expertise for questions. We have provided testimony. Both the AARC, Department of Defense, and the Council of State Governments have provided testimony at the state hearings on this legislation. And we have had individuals with expertise available to be able to give presentations to our state respiratory care boards. What we've done at the AARC office is we've coordinated this whole effort. So we work as your liaison to all of the partners, and we've sent out action alerts in the states. We've reported on the good work and information sharing, and we have a task force that is co-chaired by two volunteers, Ron Paswald and Lexi Caraway, and that task force has been very engaged in doing outreach to the state respiratory care organizations. So the compact, you can find out more about it if you go to this QR code. I'll give you a minute to capture that. So the Respiratory Care Interstate Compact is a very important initiative, not just because of the compact, but also because of the role that has been played by all of the partners. And this is a really great example of how a professional association like the AARC has been able to work with partners like the Department of Defense. They have a state liaison office. They divide the country into 8 regions, and those state representatives are hands-on with helping our state affiliates engage in this legislative initiative. The Council of State Governments, I told you a lot about them, and then our state affiliates. So the AARC has offered professional leadership and legislative support. The DoD has helped to identify sponsors and provide testimony, but they cannot lobby because they are federal employees. And the Council of State Governments has helped to identify sponsors in the state legislature, provided testimony, reviewed legislation when it's in its draft form, and offered legal support. So they have attorneys on staff who have specialty in compact licensure. And then the state affiliates have done the legislative advocacy and the local implementation. And this is crucial that all 4 of these partners have engaged to make this very successful. So I just want to let you know that your voice has to be heard. The respiratory therapists who are practicing in the state have to be heard for this to be a successful program. So what's happened? We just had Tennessee last Thursday sign, and they became the 13th state. So you can see that we have Alabama, Iowa, Kansas, Kentucky, Montana, Nebraska, South Dakota, Virginia, Washington, West Virginia, and Wisconsin who have passed this legislation, and Tennessee is the 13th state. So you guys have a real compact now. When this is actually up and running and able to be implemented, and when you are able to get a compact license, you will be able to practice in any of these states the same way that you can in your home state if one of these states in purple here is your home state. So let's talk a little bit about the compact and what happens next. So we have moved from the concept and from our legislative initiative, although we have many states who have the legislation in various stages of development and passage, to the implementation phase. So what happens next is that the compact is governed by an interstate compact commission, and that was triggered once we had 7 states, and each member state appoints one commissioner. And the compact is governed exclusively by state regulatory officials who are appointed by each member state. So, and not just anyone can be a commissioner on the compact. You have to be a regulatory official from that state. So we have contracted with the Council of State Governments to set up and run the commission for the first 6 months. And then they will take us through the period when we put out a request for proposals to get an organization and find someone to run our commission. And most of those commission meetings will be open to the public. And they're going to be boring. They're going to be regulatory. They're going to be reviewing bylaws and rules and regulations, setting up subcommittees who will review the various areas of jurisdiction that the commission has. Let's move on to one of the other initiatives that AARC has focused on for the past 2 years and will continue to focus on at our fly-in, and that is what's called the Supplemental Oxygen Access Reform Act, SOAR. And this is a piece of legislation on the federal level. Now remember, the compact is state legislation. This is on the federal level where we are trying to reform the payment methodology for oxygen, because we have found that patients are having serious access problems, specifically with liquid oxygen. So let's talk a little bit more about the SOAR Act. So the SOAR Act is based on 4 pillars of reform. First, to ensure that oxygen is patient-centric, and we wanted to redefine that in the Medicare system as supplemental oxygen, because when it's been called home oxygen, Medicare has said that all of patients' needs are met in the home. That may be true, but that doesn't allow them to be outside of their home and to be able to go to doctor's appointments, grocery shopping, all the things that they need to do to continue to be independent. The second pillar of reform is to have an add-on payment for liquid oxygen. And then the third pillar of reform, where the rubber hits the road really for respiratory care, is that there will be a statutory service element to provide adequate reimbursement for respiratory therapists to ensure patients have access to their expertise. We know from some data that's been collected that a lot of times the durable medical equipment companies, particularly when a patient is discharged from the hospital to the home and is receiving the equipment for the first time, they may not see a healthcare provider. They may only see a truck driver. So we want to ensure that respiratory therapists are able to do home visits. So there's an add-on payment in this legislation that does that. And then finally, the fourth pillar of reform is a standardized ordering template, an electronic ordering template. That means that if there's any question about what the order was or any questions about fraud and abuse, it's easier to go back through the system than to go back through handwritten orders that may have been done by the physician or other forms of ordering or prescriptions. This will be one form that's used by across the system. So the SOAR Act has 2 bill numbers in the House and the Senate. We have Representative David Valadao, a Republican from California, who is our primary sponsor in the House. Julia Brownlee has been a co-sponsor, a Democratic co-sponsor. Adrian Smith and Gabe Evans have supported us. We also have a host of other co-sponsors. I think we're up to about 50 co-sponsors now in the House, but these are the people who have been in leadership. And then on the Senate side, we have Senator Bill Cassidy, Mark Warner, and Amy Klobuchar, who have been the leaders here. Now, Senator Cassidy, who's a Republican from Louisiana, is a doctor, and he voted against Trump. And so Trump put a lot of money into supporting the person who was running against him, Julia Letlow, and she won a lion's share of the vote in the primary, which means that Bill Cassidy now is going to become, Dr. Cassidy will now become what's called a lame duck, because he won't be returning to Congress in the next session. So we're going to be working really hard to get this legislation passed in this session of Congress. So it was the focus of our 2025 fly-in, and you can see the picture down here of the respiratory therapists that come to Washington, D.C. We usually have 2 respiratory therapists from almost every state, so almost 100 respiratory therapists. They have last year they had 255 meetings in one day with the House and the Senate. And our fly-in is taking place this year, coming around the corner in June, on June 1st and 2nd. So advocacy, my message that I want to leave you with, is really a team effort. And AARC offers national leadership, the federal strategy, coordination, and education, but our state affiliates are very important with local advocacy, grassroots outreach, legislative engagement, particularly when it comes to working on this compact and making sure that the legislation is introduced in the states. And for RTs and students, we issue action alerts. We have legislative meetings. It's very important that we tell personal stories and talk about professional engagement, because without respiratory therapists going to the Hill or going to your state legislature and talking about what you do, no one would know. So we are working to make respiratory as well known as nursing, and everything that we do is, again, focused on trying to expand your ability to reach patients and improve their health outcomes. So with that, it is really my pleasure to turn over the program to Megan Koster, who is a phenomenal volunteer with the AARC. So Megan, thank you for being here on this webinar today, and let me turn the program over to you.
Thank you. Well, I appreciate it. And thank you so much for having me. If you're anything like I was when I first started getting into this, everything that Miriam just talked about was a lot to digest, right? And so I just really want to thank her and the AARC for the work that they've done so far. So a huge thank you. One of the things that I really want to drive home that Miriam also mentioned is it's not just somebody else's responsibility to advocate for our profession, right? It's not just the AARC's responsibility and Miriam and her team. And one of the things that really got me into volunteering is, again, to give RTs a stronger voice here. One of the things that really bothered me when I was by the bedside was the apathy that I would hear from people who have been in the profession for a really long time. And that really bothers me. So if you're apathetic but make no moves to improve your station or improve things for your profession, you become part of the problem. So that leads you to the question of how do you get involved, right? And nobody, like Miriam said, has a better voice than the people who are by the bedside and working with patients. And so that becomes your why. And as she mentioned also, one of the biggest barriers to people understanding our profession is the fact that you probably haven't interacted with us unless you needed us. So it becomes a very specific sample of the population. So I said, we have to get the word out about what we do, right? And I think Heather said it in the chat as well, is we have to fly our own flag as respiratory therapists to help people understand what we do. So I really was invested in doing something like that. The other reason is, our patients deserve that. Patients deserve high quality care at all levels by skilled physicians. And it is really devastating, right, to get a diagnosis that then you have to maybe go home on oxygen or have care at home with little to no education. And respiratory therapists are poised to do that education. And so really working on ways to leverage our skill sets to kind of step out of the shadows and more into the forefront to make sure that we can deliver that quality care to patients is really, really important. I will say working in the government space was never something that I thought I would do. I will be the first to say that people mention politics and I usually just shut down. And as we'll talk about in a minute, this is not necessarily about politics, it's about advocating. And so it's one of those shifts of your mindset is you are muted, yes, is making sure that it's not necessarily about politics, but it's about advocacy for the profession, advocacy for your patients. And so really separating those two things has helped me reframe how I approach some of this stuff. So doing this has really helped with leadership skills. So you're thinking like, oh, I'm brand new to the profession or I'm just getting started. I don't think I'm the right person to say some of this stuff. Nope, you are absolutely the right person to say some of this stuff. You have a fresh take on the profession. You have skills that are developing by the bedside. You're establishing relationships with patients. And so getting involved is really something that is helpful to develop skills for you as well. One of the biggest skills I've developed as I've come on board here is listening. One of the things about not knowing a lot is understanding when and how to gather information. And so really taking a moment to listen to things that are being said by people who have been in this space a little bit longer was really important. Information gathering, and then working to develop succinct and relevant information for people who don't have a lot of time. That is a skill. As you work with physicians, I'm sure we'll all hone this skill a little bit more as we work with physicians who want things yesterday. Legislators and politicians are kind of the same way. They kind of want everything in a nutshell. And so you need to be able to speak about some of these things, both in a nutshell and then on a deeper level when asked. And then finally, as a delegate and in some of my other roles, especially with AARC, I've been really able to start to model what it looks like to get involved at lots of different levels. I was really lucky that as I came on to my state society, I actually started as the secretary and then evolved into a delegate. And so getting your foot in the door somewhere is really just all it takes. Students really, they understand the why. I think you guys understand the why. Graduates understand the why. It's just sometimes understanding the how that, and usually your state society are there to help you. So could we advance the slide, please? Thank you. Awesome. So what does RT advocacy look like? Well, Miriam did a great job of kind of overviewing. And it really depends. So we have lots of different ways that we can begin the advocacy process. Sometimes it's talking to people in the field and saying what's going on. Sometimes it's getting involved with your state society. A lot of these state society meetings are actually open meetings, except for perhaps executive sessions. And so they should be able to help share this information with you. You know what? It never hurts to reach out and ask a question about what's an open meeting. Hey, can I come? Can I get involved? Is there a subcommittee you need help on? This will be different at different states, depending on how large the organization is and how organized they are. As a constituent, you are always free to meet with legislators and staff, and I really encourage you, if you don't know who your representatives are, to go online and find out who they are. Hopefully you voted, but if you didn't, I would say, hey, who is my representative in my area and how can I get in touch with them? Usually they will have a website and you can schedule a call or you can send an email to them. It's actually very easy to do. If you have the opportunity to participate in an AARC fly-in, this is an amazing opportunity to learn about this from people who have done it a million times or are doing it in bigger states or perhaps doing it more successfully than perhaps your state is. When you get an action alert, that's super helpful. Respond to that. Educating policymakers is huge. Supporting licensure legislation and sharing from frontline experiences. Again, they want to hear from you. Legislators want to hear from the people that they do represent. And that's why I think I stole Miriam's thunder on this slide, but real stories from RTs, students, new graduates about how policy is affecting you, your practice, and your patients is what they really want to see. Miriam, did you have anything to add on there?
No.
Okay, fantastic. Would you advance the slide, please? Wonderful. So as we've talked about a little bit today, advocacy really begins, I think, with visibility, right? It builds leadership skills. Some of these things that are listed here, we've talked about a little bit. Communicating effectively has been a huge opportunity for growth. Again, just because you may be new to the profession or new to advocating doesn't mean that what you have to say is not important. Your perspective is incredibly important. So never forget that. Public speaking is always scary, but it's something that we have to be able to do in order to communicate effectively and efficiently. Again, if we continue to stay in the shadows because we're a little bit afraid to be thrust into the spotlight, then we are doing our profession a disservice. We need those people that can communicate effectively and aren't afraid to do so. Networking has been huge. One of the things that Idaho recently did that we've never done before is hire a lobbyist, and we were really fortunate to get someone who was really well connected in the community and has broadened our state society's network. Again, that has contributed to visibility of the profession. And so just something as simple as introducing yourself to a legislator, beginning some of these conversations, and then working towards getting your point across is really huge. Understanding policy is, I think, probably one of the biggest barriers to people getting involved, especially when they're brand new to the profession or brand new to advocating in general. Don't let that stop you. The AARC has lots and lots of resources, Miriam being one of the primary ones, to help explain policy to you. So get in there, read the policy. There are lots of resources to help you kind of peel back some of the language that you may not understand towards the main points of some piece of legislation or policy. There's a lot of other resources, right? There's some AI usage that you can say, hey, can you create or can you look at this policy and give it to me in lay terms? That's a great place to start. When I think about the things that I don't understand about policy, I ask myself, and I have to frame the policy to say, how does this help respiratory care? How does this help the patients? Does this create or remove barriers to quality of care? And who else might this affect that I need to keep in mind, right? One of the things that we don't want to do when we advocate is sometimes come in like a complete wrecking ball, forgetting that we do need to work in a collaborative way with lots of other stakeholders. And so working to broaden your worldview of what the policy really means or the piece of legislation really means in terms of that collaborative approach is really helpful. So thinking about, hey, who could I partner with to make this a little bit easier? The other thing that I want to say is leadership opportunities are there, that we are in no shortage of needing great volunteers to be involved. So I always say, get involved, maybe with your educational institution, ask your faculty, ask the leaders in your healthcare organizations what they're doing to push the profession forward to advocate for respiratory care. The state societies are always looking for wonderful volunteers to help them. I can speak from experience in Idaho as we are always, always, always looking for people to take on some piece of what we're doing. It takes a lot of people and it takes a lot of time. And so spreading that workload is really, really beneficial. The AARC has lots of different ways to get involved, many different communities and committees to be a part of. So I really encourage you, as you're exploring what speaks to you within this profession, to get involved. Ask questions. What's the worst that they're going to tell you? We don't need help right now. Okay, I'll try again another time, or I'll go a different way. If you're still a student, look at opportunities within student groups to get involved. If you have a student group within your institution, that's a great way to work with your faculty to go to the legislature as a whole group or your state society to be a subcommittee of students to help push some of those initiatives forward. I would also say it just broadens your worldview in general. So sometimes when we don't know where we're going, all we need to do is start asking questions. And then that's when the opportunities arise. And we can say yes to those opportunities that speak to us. And then we start the ball rolling, right? So we have clinical leaders, educators, administrators, national advocates, all working together towards shared initiatives. And I think that really makes us stronger. So you can become all kinds of things with just one simple step of asking a question. Would you advance the slide? So you're going to hear us harp on this all the time. Anytime you talk to one of us who's active in the AARC, it's going to become an AARC member and maintain your membership. Join your state society. Again, they're always looking for help. Okay, so ask that question. Start small if you're intimidated. That's totally fine. Participate in advocacy alerts. When you see that come through your email, through something like Muster, participate, get a hold of your legislators, attend some of these webinars just to, ask questions or say, hey, I would love to know a little bit more about that. If you have the opportunity to attend a fly-in, they're great. They're really fantastic and broaden your network. Connect with mentors. A lot of people who are active in the field are really excited about bringing up the next generation and helping make your launch into the field a little bit easier than maybe ours was. So please, please, please look for those mentors, become a member of some of these Connect groups and be part of the conversation. Follow legislative updates. Now, I know this one can be a little bit daunting, again, because sometimes there's so much information coming out and we don't know how to filter that. If that happens, start with one initiative. Ask your licensing board what's going on. Is there anything coming down the pike that we as respiratory therapists should be aware of? And can you use our support in some way, shape, or form? All of that information should be publicly available to you, and so it should not be hard to find. And again, share your experiences. It does not matter how new you are to the field. Your perspective is invaluable and needs to be shared. They want to hear from you. Legislators want to hear from you, and how they can help support you. So again, ask questions, look for opportunities, and look at what's going on in your state and how you can contribute. Can you advance, please? So my advice is don't wait until you feel like an expert, because I don't think that's going to happen. Okay. Many of us who have been in the field for a really long time are still learning. And I will say, don't let it happen in a vacuum. You are not supposed to have all of the answers. That's why we are better and stronger together. So your voice matters, your perspectives matter, and it's really influential that you leverage those voices and perspectives for the quality that your students, I was going to say students, that your patients receive. So in a nutshell, advocacy is leadership. It's about becoming a better respiratory care practitioner, a better advocate. And it all is very cyclical into who you become and what you then contribute into the field. We work for professional engagement because we realize that collaboration is stronger than working alone. And it's about patient protection. As Miriam really highlighted with the SOAR Act, there's lots of benefits for patients. I live in a rural state that is classified pretty primarily as rural. And as I was doing some research, it seems like most of these patients on oxygen have to travel over 100 miles to get to an institution that does pulmonary services. Now, if you were on 2 liters of oxygen, you might need 1 or 2 tanks to get there. If you are on a higher flow than that, you're going to need a lot more tanks, and that impacts your ability to be mobile. So see how easy that was for me to put into a verbal talking point for a legislator that makes sense. So again, it's not hard. It's just about picking one piece. And the more we speak together in one voice on certain things, the more people know about us, the more visibility we have, and the stronger we are together. So it really is an investment in the future of respiratory care. Go ahead and advance. And so I think I've hit this nail on the head multiple times. Legislators remember something that they can connect to, right? If we come in and just start spouting off all these numbers, that's one thing. Some people will remember that. But think about why you got into respiratory care. Think about what your why was and what became important to you as you moved through school, and what was important about picking that first job. What was important about, picking where you wanted to specialize, if that's something you did. It was the why, right? It was the thing that filled your cup. It was the thing that made your heart beat. It was the thing that keeps you going in every day, right? Legislators remember those stories. That becomes their why. That's why they got into politics, and that's why they got into things, was to represent the voice of the people. So share those stories, share those perspectives. That's what becomes very memorable to legislators. Again, students and young professionals, a lot of legislators look at you as the future of their state. So again, your voice is incredibly important. And as I mentioned earlier, advocacy is not necessarily politics. You do not have to agree with things that your legislators do. That's not what we're talking about here. So if you can reframe advocacy away from an alignment with a specific political view, that is incredibly helpful. If you remember that I am advocating for the profession of respiratory care, I am protecting my patients, I am here for my profession, I'm investing in not only my experience, but the experience of the clinicians who come behind me. That helps reframe your objective to moving the profession forward rather than alignment with specific views. So I realize we went through that in a really fast way, and I hope that we've giving you a couple final takeaway. Again, like Miriam mentioned, advocacy has many different impacts here, and they're listed for you here. You need to be visible, and I don't want to say you need to be loud, but you need to be heard. So again, protect your license, protect your autonomy as a clinician, your mobility, the places you can go with your career, protect your patients. They cannot always advocate for themselves. And so you need to do that for them in certain aspects. And if you can bring them along with you, that's even more impactful. So, Miriam, anything else to add here?
No, I think you did a phenomenal job of talking about how to engage, why to engage, and what you can accomplish if you engage. And also the very important point that advocacy is not politics. And so if you have a member of Congress who you are not aligned with their perspective, it doesn't really matter, because in many cases, what we're trying to do in advancing the profession and giving opportunities for patients to have better care is bipartisan. It's not partisan. It's not necessarily a Republican or a Democratic perspective.
Absolutely. One of the things I will share, and I don't know if there are questions or if that will be moderated. One of the things I will say is advocacy becomes again about framing, and we've mentioned this multiple times. And so one thing that as I have learned is the legislature within my state has a specific perspective. And so as I think about my talking points, I do think it's incredibly helpful to understand how you can implement how this affects your state. Right. Again, as I mentioned, I'm from Idaho, so a lot of my state is very rural. My legislators are very interested in how legislation is going to impact patients who are in a rural area. And so a lot of my research and deep dive into how I can make this matter to legislators in Idaho has been to connect it to my rural communities and how it affects those patients. And so that's the frame that I'm taking. Now, someone from a different state with a legislator that has different views may take a different frame, a different perspective. But that's where you come in as the advocate, is to figure out how to make this make sense for legislators. You are that bridge between what we want as a profession and clinicians versus how we can make the legislators understand why that's important. And so I think, yep, our contact information is here. I'm always happy to field questions as co-chair of the Advocacy and Governmental Affairs Committee. Happy to do that on a personal level as well. So just get a hold of me if I can be helpful at all.
And you guys can always reach out to me. I love to talk to students and people who are just beginning their interest in advocacy and engagement.